Breast lift or a mastopexy is an operation we perform for patients who feel as though their breast has maybe descended a little bit on their chest. The breast becomes a little more droopy or saggy, patients will say. And typically that's a patient who's had one or two children, or sometimes not. Sometimes just a patient whose breast is a little bit lower on their chest wall than they like. And the operation to fix that, again, is a breast lift. The way we accomplish that is some small incisions around the areola or the nipple, and then generally at least a vertical scar down the breast that helps us to kind of gather the breast tissue and reposition the breast higher on the chest wall. Breast lift with a breast augmentation is a very common combination of procedures that we do. That's usually for mothers or women who have had one or two children maybe, and at this point they notice that the breast tissue after breastfeeding may shrink, and it's called postpartum involution. The breast gets a little smaller in addition to moving down the chest wall, and the operation for that usually is what we call augmentation mastopexy. And the way that's done is through the same incisions. However, at the same time as the breast lift, we'll place a breast implant, usually under the muscle, and then perform the breast lift on top of that. That's a nice combination of procedures that restores some upper pole fullness or fullness to the breast higher up on the chest, in addition to replacing the breast and nipple higher up on the chest wall. You know, breast augmentation with the lift is one of those operations that patients typically are very pleased with. It seems to restore the breast back to a condition that it might have been in either prior to childbirth and breastfeeding, or just in general a more youthful breast. Here at Gaines Plastic Surgery, we have financing options available through CareCredit. We'll allow patients to finance the procedures that we do through this clinic for up to 6 months with no interest.